how can this be life-threatening?
So when you have a fever and a rash, meaning that there's some connection between the inflammation in the body, as your immune system is going haywire, that can affect every organ system. So it can affect your heart, your liver, your kidneys. It can influence oxygenation, blood flow. It even can influence the nutrients in your blood, things like sodium and potassium and calcium. And they need to be at a very certain level. And when they go too low or too high, that can wreak havoc on other areas of the body. So in these what are called high metabolic states, that can put someone in a position where their other organs can start to fail. So this could be extremely dangerous. So again, calling this the right thing, getting on the right treatment and preventing these flares is going to be central, not just to management, but preventing these life-threatening situations.
Hey everyone, this is Jonathan Marks from Go2 Health. Hope you're doing well today. Today we're talking about the chronic and potentially life-threatening condition of psoriasis and a special type called generalized pustular psoriasis, or GPP. GPP is a chronic autoinflammatory disease that is characterized by flares which can appear suddenly in the form of painful, non-infectious, pus-filled blisters, which can vary greatly in their presentation but have a severe impact. The disease is also associated with ongoing symptoms such as pain, fever, and fatigue. Diagnosing GPP can be difficult because its symptoms can vary widely from person to person. For those who live with GPP, the disease can have a significant physical and mental impact, including effects on career, relationships, and social life, with more depression and anxiety compared with those folks who suffer from common plaque psoriasis. This underscores the need for increased awareness, timely diagnosis, and comprehensive support. We have two guests to talk about with us today. Adam Friedman MD is the professor and chair of dermatology and serves as the director of the residency program, translational research, and the supportive oncodermatology programs in the Department of Dermatology at the George Washington University School of Medicine and Health Sciences. Also with us is Mary Robinson, who has lived with pustular psoriasis, GPP. She's from Jacksonville, Florida. She was diagnosed in 2021. Her symptoms first appeared soon after childbirth during the postpartum period. Now a mother of 5, she has a passion for raising awareness among healthcare providers and the general public about GPP and emphasizes the critical need for better education about GPP. If you're enjoying our series, it would mean the world to us if you took a second to leave a 5-star review on YouTube or Apple Podcasts or Spotify or wherever you're listening to us. This helps more people find the show and lets us know we're on the right track. Thanks in advance. So, welcome to the show, Dr. Adam Friedman and Mary Robinson. How are you both today?
Going great. What about yourself?
Doing well. Thank you for having us.
Good. I'm doing great. So, Dr. Friedman, tell us, what is GPP and how does it differ from, I guess, more regular plaque psoriasis?
Yeah, no, it's a great question and a really important one. So generalized pustular psoriasis is a chronic inflammatory condition that affects the entire body. Now, to your point about psoriasis, you could argue that's a similar description, but this is a unique disease defined by what drives it in terms of what are the parts of the immune system that are turned on and can't turn off. So it is distinguished. From a clinical perspective, the skin rash looks a little different. It can occur anywhere on the body, but what's unique is that it can be studded or covered with little non-infectious pustules, meaning blisters filled with pus. This condition is definitely way more than skin deep. It can affect every organ system, and often patients in a flare will have fever, joint pain, lethargy that can easily lead them to a hospitalization. And most notably, this can be life-threatening. So getting the right diagnosis and right care is central to success.
So tell us, how can this be life-threatening?
So when you have a fever and a rash, meaning that there's some connection between the inflammation in the body, as your immune system is going haywire, that can affect every organ system. So it can affect your heart, your liver, your kidneys. It can influence oxygenation, blood flow. It even can influence the nutrients in your blood, things like sodium and potassium and calcium. And they need to be at a very certain level. And when they go too low or too high, that can wreak havoc on other areas of the body. So in these what are called high metabolic states, that can put someone in a position where their other organs can start to fail. So this could be extremely dangerous. So again, calling this the right thing, getting on the right treatment, and preventing these flares is going to be central, not just to management, but preventing these life-threatening situations.
Thank you for explaining that. Now, this is an autoimmune disease. Can you briefly explain what it means to have an autoimmune disease? What is autoimmune?
Yeah, so the lexicon's a bit interesting here. So autoimmune means that your immune system recognizes self as foreign. I tend to think of this more as what's called auto-inflammatory, meaning inflammation is turned on and it can't shut down. Our immune system has these fire alarms for infection, wound healing, and these are a good thing in little bits. But in GPP, one particular fire alarm cannot shut off, and it just drives more and more inflammation, which in turn causes injury to the skin and other organs.
Thank you for explaining that. Mary, you have been diagnosed with GPP. How did you first learn you had it? Did you have plaque psoriasis before? Tell us a little bit about your story.
Sure, thank you. So being diagnosed with it was very shocking, alarming. It took a while to get the diagnosis. No, I never had plaque psoriasis before. So it was definitely a shock, to say the least. But once the diagnosis came and, I started educating myself and researching myself, it became understandable. Now it's better than before. So it's definitely a condition that, you have to educate yourself to know what to do and how to do. It's definitely a journey, and it comes with a lot of different twists and turns. So be prepared and buckle up.
Okay, that's good. So, Mary, when you first got diagnosed, did you go to your regular doctor? Did you go to a dermatologist? How did you first treat this?
Great question. So it started off with urgent care. From urgent care was primary care. From primary care, it was my specialist. From that specialist, it was another specialist, another primary care. So it was like 6 or 7 doctors involved all at once. But the true answer came from a dermatologist, because one of the specialists was like, listen, person that is best with the skin is a true dermatologist.
I'm not going to disagree with that whatsoever.
Okay, good.
As dermatologist, it was that diagnosed.
Good. So, Mary, you got diagnosed, or you first had this disease. Was it during pregnancy, after your delivery? When did that happen?
Sure. So it was 1 month after delivery, actually. So
Okay.
yeah, it was quite shocking, to say the least.
I'm sure you were busy with a new baby, and then here this happens. Dr. Friedman,
Yes.
Does pregnancy or delivery bring this on?
It can. So with a condition like GPP, stressors like, delivery and having a baby can certainly wake it up. This also speaks to even stress on the skin itself. So scratching or friction can wake up a plaque of this in those areas. So that's something that even Mary and I have talked about in terms of even clothing choices that you have to really consider. But no doubt stress and even diet, meaning things that you inherently think are probably bad for you, are going to be pro-inflammatory. Things that are what are called high on the glycemic index, that have a lot of sugars, can wake up an inflammatory disease. But I want to be clear, they don't cause it, they instigate it. So not doing any of these things doesn't make it go away, it just keeps it at baseline. But this is a chronic disease that needs to be managed chronically.
Got it. And Mary, how did your life change once you started having this condition?
It significantly changed, as a parent, having a newborn.
Yes.
And now you have this condition on top was another layer. So it definitely impacted my social life, my parental life, my career life. So it's not something that can just cause an issue for one thing. It's the whole aspect of life. However, I always say control the controllables. So I know to control what I'm in control in to help with the condition.
Good. And when you say it affected your life and your career, were you isolated? Did you have to stay home? How were you doing mentally with this? This must have been very distressing.
Oh, mentally, it was there, going out in public and people seeing you with all these pustules, that there's something off The Walking Dead. Sure,
Oh, dear.
So, yeah, so and I have to tell people like, no, it's not, it's not contagious, so you're fine. Mentally, I wasn't used to looking that way with the pustules, so it does bother your mental. Career-wise, you don't want to do nothing, in a flare and you have everything going on, you don't want to be moving all the time. So you just want to sit there and be alone. So parenting, I can't be the mother I want to be, the fun mother, the outgoing mother, because you have this flare going on. You can't move as much. You can't do this. Any little trigger, bothers it. So it does play in an active life, and it bothers everything you do. So you have to be aware of it.
Thank you. So if people want to learn more, and I do have more questions, but if people want to learn more, you can go to gpandme.com. That's gppandme.com. So both of you, I understand August is the first ever GPP Awareness Day. What's happening and how is it going to help people with becoming more aware of this disease?
So as someone living with the disease, it's bringing more education, it's bringing more awareness. I'm glad we have it now. I don't want anyone to experience what I went through when I first got diagnosed. I didn't have no one to turn to. I didn't have no education on it. It was more so I'm just digging through everything, trying to find answers. So someone who's starting out, they don't have to go through this journey alone. It's also good in bringing awareness for the loved ones that are surrounded by you. It's making them aware so they don't think that something is wrong with you mentally when you're telling them, okay, this is what's going on. And it's also making the doctors aware. Not too many doctors run into this condition or see this condition. It's textbook classic, as my doctor likes to put it. So it's bringing awareness to them as well. So it's a great thing that we're doing this.
Yeah, I have to echo Mary's sentiment, and obviously she's a hard act to follow. And I'm so unbelievably appreciative of Boehringer Ingelheim for supporting this National Awareness Day. I'll speak with my residency program director hat on in terms of training the future of dermatology. When you deal with rare diseases, which that's a lot of dermatology, disease that affects 1 in 10,000, education is so central to not missing it when it walks through your door. So a day like today is an incredible excuse to focus on basic education, pattern recognition, but also investing in research and future development for targeted therapies that can make this easier for those who are suffering.
So you bring up a good question. How do people get treated when they have this condition?
So historically, we use what's called, it's kind of the dreaded word of off-label, meaning things that were never meant for it, but we didn't have any other options. Now that we understand the underpinnings of disease in terms of what are those fire alarms that are going haywire, targeted therapies that go after those drivers of disease are available and more are coming. So the good news is you go to your board certified dermatologist, they make that diagnosis. We do have options that are effective in managing this.
And let me just ask either both of if I start seeing something on my skin that's unusual, such as these pustules or some kind of plaque, who do I go to see first? Do I go to see my general practitioner? Or do I try to go see a dermatologist? What's the best way to handle this when I first notice it?
I mean, I'm going to be biased and say board certified dermatologist, but by the end of the day, I think definitely going the dermatology route, because I think, and Mary alluded to this, being that there are pustules, the insinuation is this got to be infectious, right? So pus equals infection, which is absolutely not true, but that's the general dogma. And so that will misdirect. You have your best shot of seeing a dermatologist because they will include this in the possibilities of things that this can be. And hopefully that will lead to a skin biopsy and ultimately the correct diagnosis.
Good. So we get to this part of the interview where I ask my favorite question. What question haven't I asked that I should have asked? Or what would you like to leave as a message with people before we end today?
Sure, I'll take that away.
Good for you.
The first one is education. Education is key. 2, don't settle or never give up. And 3, it is your journey. It is going to be a journey that, it's going to take you a lot of different ways. But the goal today is to stay on the journey and keep your hand on it and control it as much as you can.
I mean, mic drop. I can't say anything after that other than, you didn't ask what's the meaning of life, but I don't think any of us could probably answer that one.
Okay, good. Well, thank you so much for being with us today. We've been talking with Adam Friedman, MD. He's the professor and chair of dermatology and serves as the director of the residency program, as he mentioned, also translational research and the supportive onco-dermatology programs in the Department of Dermatology at the George Washington University School of Medicine and Health Sciences. And we've also been talking with Mary Robinson. She's a person living with generalized pustular psoriasis, GPP, from Jacksonville, Florida. She was diagnosed in 2021. Her symptoms first appeared soon after childbirth during postpartum, and now a mother of 5, she has a passion for raising awareness among healthcare providers and the general public about GPP. Go, Mary. Great. Good. So, thank you again for being with us. And as a reminder to everybody, if you're enjoying our show and would like more people to share in this information, please give us a 5-star review on Apple, Spotify, YouTube, or wherever you're listening to us. And remember, as we say at the end of every show, go to health. This has been Jonathan Marks. See you next time. Thanks for being with us. Take care. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marks in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at gotohealthmedia.com. See you next time, and remember to elevate your life with Go to Health.